Good evening. Welcome to the 97th Annual President's Gala, our first virtual gala. This is our waiting room where we will honor our sponsors, show you the NDA Centennial video, and hear from Dr. Michael Reddy, the Dean of the University of California, San Francisco School of Dentistry, and many more speakers. Thanks for joining us and enjoy our program.
Hi, my name's Luan Hull, and I'm a pediatric dentist from California. A lot of people ask me, how did you get so involved in organizing dentistry, and how do you find the time? I was very fortunate from my first year of dental school to be encouraged by the dean of our school and by Dr. Bill Hoskins, who was my associate dean at UCSF. And from the very beginning, they said, we want you to get involved and serve as a leader. And I was so blessed and fortunate to have that great advice and support. I became the student body president of UCSF and eventually the alumni president of the organization. And I look back and I say, if it wasn't for members of the NDA that encouraged me, such as Dr. James Forge, I wouldn't even have been a student. And through the support of other people, it really made a difference in making my career so wonderful and full. I'd like to also encourage you all to think about a way to support students. For me, I was so fortunate to have mentors, and they helped guide me throughout my profession. How can you support students? The first thing, students need money. If you can find time to go onto the NDA website or give butter and give to the National Dental Association Student Scholarship Fund, that is one way of helping others, because without that support it is so difficult for students to flourish in their environment, because right now we're in very challenging times, and if students have that ability to start serving as leaders, I would love to see some of the students that we have in schools right now step forward and have the opportunity to do what I have in dentistry and make it a better profession.
Hello, my name is Michael Reddy, and I have the privilege of serving as Dean of the UCSF School of Dentistry and as a member of the NDA. The University of California, San Francisco, as part of its commitment to diversity, is proud to be a supporter of the National Dental Association. We have enjoyed a long association with the NDA and its student group, the SNDA, as an association that speaks to our shared resolve to uplift and sustain Black students in their path to dentistry. Today, I'm happy to share that UCSF is a proud sponsor of the NDA 2020 Scholarship Fund and the President's Gala. I'm also delighted to speak for the university in support of one of our esteemed alumni, Dr. Pam Alston, incoming 97th president of the National Dental Association. Woohoo! Dr. Alston has been a long supporter of her alma mater through giving her time, sharing her talent, and her treasure with the university. Notably, as a volunteer faculty member, she is beloved by students and has generously shared her experience and passion with so many of our learners. She's also been a caring and trusted mentor to many, especially our Black students. In this and many other ways, Dr. Alston fully represents the ideals of the University of California, San Francisco. As the NDA president, Dr. Alston will be a champion for health equity, for student support and opportunity. The UCSF community is galvanized behind Dr. Alston. The university has pledged its financial sponsorship for Dr. Alston's presidency. Contributions also have come in from faculty, staff, administrators, alumni, and current students. This level of support speaks to the high regard we have for Dr. Alston and our confidence in her leadership. We congratulate Dr. Alston on this achievement and look forward to the accomplishments that are sure to come. Pam, thank you for leading us and for all that you do.
At this time, we would like to give special recognition to one of our titanium sponsors and NDA past president, Dr. Joseph Oliver Jr. Born and raised in Baltimore, Maryland, Dr. Oliver attended Morgan State University, where he graduated with a bachelor's degree in mathematics. After graduation, Dr. Oliver served his country in the military and ultimately moved his young family to Milwaukee, Wisconsin. While in Milwaukee, Dr. Oliver attended the University of Wisconsin, achieving a master's degree in mathematics. Seeking out new opportunities, Dr. Oliver moved his family to Southern California, where in 1965 he started a career in the aerospace industry. Looking for new challenges, Dr. Oliver applied and was accepted into the 1972 class at the University of Southern California. After graduating, Dr. Oliver opened a private practice, first in Inglewood and then in Torrance, California. He was lucky enough to practice with his daughter, Toni, for 35 years. While in practice, Dr. Oliver mentored many prospective dental students and served in organized dentistry. He held numerous leadership roles in organized dentistry, including the USC Minority Dental Student Association President, Angel City Dental Association President, California Dental Association House of Delegates, Western Los Angeles Dental Society President, National Dental Society President in 1991. Dr. Oliver has 7 children and 7 grandchildren. His granddaughter, Jordan, is now a freshman at the UCLA School of Dentistry.
We stand on the shoulders of those who laid the groundwork for us. They saw the need for an organization for Black dentists. They overcame the atrocities of Jim Crow. And because of them, today, we are a legacy of leadership, a tradition of service. We are the National Dental Association, celebrating 100 years of greatness. In 1900, 12 Howard University dental alumni met in Washington, D.C., and founded what was then called the Washington Society of Colored Dentists. There was a need for a professional dental organization to address the needs of colored professionals. They planted the seeds for what later became the National Dental Association. In 1913, the Tri-State Dental Society was formed and included D.C., Virginia, and Maryland. By 1918, members from other states had joined, and the name changed to the Interstate Dental Association. Word spread across the nation, and new chapters formed. In 1932, the name officially changed to the National Dental Association. In the early years, the strength of the organization came from persevering men and their families, determined to create an organization they could call their own. The first secretary-treasurer was Dr. John Andrew Jackson of Charlottesville, Virginia. He and his family were the foundation upon which the organization was built. Every member of his family served in some capacity. The NDA owes a debt of gratitude to their passion and commitment. When the patriarch died in 1957, his sons, Dr. George Franklin Jackson and Ellard Punjab Jackson, followed in his footsteps. Punjab served as executive director for 25 years without pay. At the height of the Jim Crow era, the NDA continued to fight for the rights of Negro dentists. World War II veterans returned home and faced discrimination and bigotry. They were denied their basic rights. Negroes were not accepted in mainstream society and could not join the all-white American Dental Association. Civil rights laws attempted to correct the injustice. Dr. Eddie G. Smith wrote the first NDA Constitution and formed its first House of Delegates. NDA leaders argued passionately before Congress to include dental care in both Medicaid and Medicare programs. However, the heavily funded ADA struck down their efforts in Medicare. In 1965, the Medicaid bill was enacted, ensuring that poor children received much-needed dental care. However, even today, dental care for seniors is not covered under Medicare. The passage of Medicaid attracted new members to the NDA. In the 60s, the Black Power, women's rights, and student movements transformed America and the NDA. The NDA moved its home office from Charlottesville, Virginia, to Washington, D.C. An executive director was hired, and the annual convention adopted a more sophisticated format. The NDA umbrella of family organizations was unique. The National Dental Assistants Association, the National Dental Hygienists Association, auxiliary to the NDA, and the NDA Foundation are vital components. In 1972, the student NDA joined the family.
And the trustee board, we managed to make it through there. We had a majority vote, had a big majority vote, as a matter of fact. Once we went to the House of Delegates, however, it became a battle.
It was just what the organization needed. Students are the lifeblood of the NDA. In that same year, the NDA published The Charrette, which chronicled the plight of those neglected by the healthcare system. The book challenged the NDA to become the voice of moral authority. Throughout the 1980s and 90s, the NDA raised its profile. In 1989, Colgate-Palmolive and the NDA became partners. Colgate has provided funding for dental research and millions of dollars in scholarships. In 1993, the NDA Women's Health Symposium was formed to address the needs of women and to honor their achievements. The Corporate Roundtable was formed in 1996 to provide resources and strategies for win-win partnerships. Henry Schein Incorporated, a founding member, has been another dedicated partner, contributing to NDA growth and progress. After 84 years, in 1997, the first woman was elected president of the NDA. 2 years later, the first annual NDA Day on the Hill was held. It is a unique program of information exchange between the NDA and legislators.
And I want to thank this organization for helping us to make sure that there was a pediatric dentistry benefit in the Affordable Care Act.
1999 strengthened strategic alliances cultivated to expand the organization's realm of influence. These organizations are valued allies. It became vitally important for the NDA to publicize its positions and to influence public policy. In 2000, the first NDA component, the Freeman Dental Society, celebrated its centennial. The first ever Surgeon General's report on oral health in America was released. Dr. Clifton Dummett was commissioned by Dr. Roosevelt Brown, president of the NDA Foundation, to write the NDA history, published in 2000. In 2005, in the aftermath of Hurricane Katrina, the NDA led the movement to enlist the support of other organizations, and Congressman John Conyers, chairman of the Judiciary Committee, to bring to justice the New Orleans policeman who killed a frightened, unarmed man. The man was the brother of NDA past president, Dr. Romel Madison. Civil rights and social justice are hallmarks of the NDA. The Eddie G. Smith Leadership Institute hones the skills of NDA leaders, ensuring leadership succession and securing the future of the organization. Tragedy struck in 2007 when Diamante Driver, a young boy from Maryland, died from untreated tooth decay. Local NDA dentists galvanized and with state, community, and corporate support created a project in his memory and purchased a mobile dental unit. The death of Diamante was a call to action. In 2009, the NDA co-hosted the Roundtable on Oral Health Disparities with the Department of Health and Human Services Office of Minority Health. The session exposed health disparities and vulnerable communities to an audience of the nation's most prestigious organizations. Our alliance with the Hispanic Dental Association and the Society of American Indian Dentists culminated in the historic Multicultural Oral Health Summit of 2012. The groups pledged to work together to improve health in communities of color and all underserved communities. Community service is a cornerstone of the NDA. In 2012, the NDA and Philadelphia's New Era Dental Society accepted an invitation from media giant Tom Joyner.
Good health starts with oral health, and so it's a natural fit.
The impact of women leaders has changed the landscape, and they are leaving their mark. The NDA's $1 million Centennial Campaign establishes an endowed scholarship fund and increases support for local programs such as the NDA Health Now, a national grassroots mobile health project that expands and takes to scale the Diamante Driver Dental Project. For the past 100 years, the National Dental Association has been leading the way for dentists of color to provide quality oral health care for the underserved and underrepresented. The National Dental Association, a tradition of service, a legacy of leadership, making a difference in the lives of millions.
On behalf of our entire team, I'd like to congratulate Dr. Alston on her upcoming term as president of the National Dental Association. As a dental technology company working with dentists across the country, we're very attuned to the disparities and inequities in our industry for both patients and providers. We're very proud to support the National Dental Association's mission to mentor the future generation of dental professionals that better represent the diversity of our country. At Dentist, we are automating dental insurance verifications and billing to help relieve the frustrations of endless hours of calling insurance companies, researching claim denials, and manually posting payments. We help front office teams reclaim their time to focus on patient care and fill their schedule, and help dentists manage the risks of embezzlement and added stresses of staff turnover. Our artificial intelligence platform automatically cleans and sends your claims, follows up on unpaid claims, and posts payments back into your software system. With Dentist, you will never need to worry about claims rolling into over 90 days or send patient statements months after their appointment. During this pandemic, we've helped hundreds of dental practices maintain a steady stream of income from cleaning up their insurance aging and reducing risks to their staff and patients by needing fewer team members in their practice. We recently launched our newest and most awaited product called ZenCheck, which is an automated insurance eligibility verification tool that pulls appointments from your software system and verifies the eligibility and benefits for your patients ahead of their appointments. I'm very excited to offer National Dental Association members and affiliates 6 months of eligibility check for free. Please head over to www.zent.ist/NDA2020 to take advantage of this offer. I look forward to hearing from you. Thank you. Have a safe and happy holiday.
Weekdays, University of California, San Francisco SNDA members are in the lab or in the clinic providing oral health care. Weekends, they may be in the community addressing social determinants of oral health. Food security is one of the top common social determinants of oral health. Before the pandemic, SNDA members participated in food recovery and meal preparation at a free dining room in Oakland. They served the meals with compassion, humility, and gratitude.
hurts. I just want to stay home. I'm having a bad day.
The biggest secret of childhood is that cavities hold kids back. Almost 50% of kids in America get cavities before they're 8. But they are preventable. When you choose Colgate, you are helping provide dental care and education for children in our community. Because healthier smiles mean brighter futures.
So my name is Terry White Mitchell, and I'm born and raised in Oakland, California. I earned my bachelor's in economics from Spelman College, and after I graduated, I worked for several years in a non-health industry that really left me feeling unfulfilled. And so dentistry is actually a passion I discovered later in life, and I don't come from a family of dentists or doctors, so I shadowed people in my church and my own dentist, and that really helped develop my interest in the field. And then I took a leap of faith and did a career change and decided to pursue dentistry full-time. And that's when I enrolled in a post-baccalaureate program at California State University, East Bay. And it was during that time where I shadowed at a community clinic for a couple hours every week for 2 years. And that really developed my passion for dentistry. And then I also had the opportunity to participate in a dental humanitarian trip to Jamaica. And I went on my own as a pre-dental student. And that's when I got the opportunity to really understand the onus of poor health can have on an individual in a community, because I got to spend time with the patients. I got to hear their stories. And that's when I saw how a dentist can help alleviate that burden. So that was a moment of conviction for me, and that's when I knew I wanted my lifelong career to be focused on marginalized populations. So now I'm in my final year at the University of Pacific, and as I prepare to take that next step to graduate, I'm looking forward for my journey to come full circle and returning to the community clinics where it all started for me, and to give back to my community and to everyone who has helped me, shape me up until this point in my journey.
There are a number of challenges with today's oral health care system. Number one, oral health is siloed from the rest of the healthcare environment. And what that has led to is a system where many people across this country, many who look like me, many who live in rural areas, don't actually have access to care.
There are barriers for those that don't have necessarily transportation, flexibility with their jobs. Again, it all comes back to money. Unless you have some type of coverage, it is simply not affordable.
Oral health is intimately connected to your systemic health. And if you're well in your mouth, very often that positions you well for the rest of your life. financial model's upside down, right? Dentists are rewarded for the amount of work they do. They're not often enough rewarded for the health of their patients.
And that system's broken. Millions of people are being left behind. And we believe that everybody can get a fair shot at oral health if we focus on prevention. That the idea that we're going to prevent the problem before it occurs will lead to better outcomes for millions of people. And we call that revolution preventistry, and we're leading the way.
Preventistry could be an industry really focused on creating good health, using the power of data, using the power of novel science, and using our understanding of the disease process to keep people well, meaning that we can predict it, we can immunize against disease, we can screen for it, and then we could manage it better.
We are committed to working with organizations around the country who are really emphatic about improving health, not just oral health, but improving health.
We have national reach, we have relationships with 25 million consumers, tens of thousands of providers, policymakers, oral health stakeholders of various kinds. That gives us the position to make the types of changes that will make a more accessible, equitable, and better oral health system.
We're better positioned than anybody because we're already doing it. We're already paying providers to prevent problems before they actually happen. We're making investments in our technology to make it easier for our customers to access appropriate oral health. And we're working to make change to policies that, again, are around prevention.
We want everyone to have the opportunity to lasting oral health. And that's regardless of age or race or where you happen to live. It is the basis for all of the work that we do.
We need to make some fundamental changes to the system, and that's really what DentaQuest does. And that's why we're so excited about the future.
What can a healthy smile do? Inspire confidence, open doors, launch dreams. We are Colgate, a caring, innovative growth company reimagining a healthier future for people, their pets, and our planet. Championing a zero-cavity future free from the world's most prevalent chronic disease, tooth decay. Bright Smiles, Bright Futures is at the heart of our commitment to help end cavities. Over 30 years, our global Bright Smiles, Bright Futures program has touched the lives of more than 1 billion children. Providing free oral health education and dental care in over 80 countries. Kids learn powerful habits like brushing twice a day with fluoride toothpaste. They laugh and feel empowered to keep their smiles healthy for a lifetime. We don't do this important work alone. We partner with parents, teachers, dental professionals, NGOs, and governments, combining our expertise to accelerate progress. Through our proven curriculum available online and in 30 languages, and through advocacy, ensuring that cavities prevention remains a top global health priority. Working together, we will reach our next 1 billion children. Championing a zero-cavity future so that everyone can smile strong. Learn more at colgatebsbf.com.